Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for tuning in with me today. I really hope you can relate or learn a thing or two. Today I wanted to discuss a topic that's talked about so many times everywhere in the media, and that's definitely the interaction between hemorrhoids and pregnancy. And when you hear those words together, you know what's coming up, right? Lots of joy from the baby coming, being born, but then there's also the real negative side of what the delivery process and also the pregnancy can do to hemorrhoids, right? And let me just go through some of the explanations behind why the hemorrhoids tend to be a little bit more of a complainer during those periods, and what can be done after a delivery, especially when you're suffering from a lot more than just that one bottom end part, right? I mean, you've got some people who have vaginal deliveries, some people who go through cesareans. Certainly deliveries are not always routine and different procedures can happen. And so the hemorrhoids just seem to be an extra, point at a point of an insult, right? It just seems like, really? Does that have to happen now too? And so let me go through some of that with you. During pregnancy, the baby is developing in the uterus, and the uterus is located in our pelvis, which is below the abdomen, right? And the pelvis is a bowl, essentially. The sides and the front and back are bone, but the top is just the intestines and whatever is in our belly that's pushing down, and then on the bottom is a muscular bowl. Literally, the muscles are kind of like slings or suspenders that kind of go in all sorts of different directions and form that cone type of shape. The other parts that are at the bottom of this cone are the anus and the vagina, and of course our urinary system. The baby is developing and it grows larger and larger until it's ready to deliver, right? What is happening? So as the baby grows larger, the weight increases, and what happens with gravity is that it pulls down and the baby's pushing onto the bottom of our pelvic bowl of all the muscles, but it's also pushing down on blood vessels, lymphatic vessels. Lymphatic vessels is the extra fluid that's around and bathes our cells, and there's also channels where this fluid also circulates and then goes back into the bloodstream again. But when these fluids all accumulate because they soak down because of the gravity, that's what can make things swell. Like, that's why your legs look more swollen and your ankles start to disappear, because the fluid is collecting in between all these spaces between your cells and between your fat cells. And so the hemorrhoids, which are blood vessels, start to feel that extra pressure, more blood, more fluid being pushed down from the baby from above, more restricted blood flow, which is preventing that from going back into our heart and returning back into the circulatory system up higher in our chest. And so the blood vessels start to get a little bit more stretched out. And you know what the swelling feels like, right? Some people see it as swelling, soreness, throbbing, and it can even be painful for some people. And that's why when you're walking around, sometimes you may feel like things are just getting really uncomfortable there. They're getting a little bit raw as well, and those are all extremely common. Hemorrhoid flare-ups can be a little bit more disturbing during this time too. Why? Because they're already more swollen from the get-go. So if you were to burst one of those blood vessels from an injury, then the bleeding can be a little bit more severe, and therefore bringing a more symptoms and more inflammation to the area, hence more of a negative experience for you as you get those symptoms, right? And when it comes time to deliver the child, your hemorrhoids may be quite swollen already to begin with, because the baby doesn't get smaller, the baby continues to grow. And what do we do during labor is you're pushing down, right? And so now more blood, more fluid, more of the inflammation, the changes from pregnancy, the hormones that are going in, the IV that is putting more fluids into your body to help the baby and the baby's blood pressure and keep those blood vessels open. Those all will produce more swelling in your anus, not to mention everywhere else in your body. And that pushing, just like when you're sitting on the toilet, can really make those hemorrhoid vessels pop and create more injuries. And so after the delivery is over, you may find that you don't notice much because maybe you have an epidural, but the epidural will wear off and you may find that hemorrhoids are just swollen all around like a ring around your bottom end. Or you may find that some of the hemorrhoids from the inside have come out to the outside, right? All these things are quite distressful, and they definitely cause you some discomfort when it comes to moving around, bathing yourself. And I want to let you know there are things that can help. So the first thing is trying to get some relaxation in whenever you can, okay? Potentially you're breastfeeding, potentially you're pumping, all these things are going on. Try to, if you can, if you do have people to help you, that's really the best thing. But even just taking a nap in the tub and just relaxing there and letting the water soothe your bottom end can be one point of help. Definitely try the over-the-counter remedies like Preparation H. Try the Tux pads. Another one you can get over the counter is called Recticare. RECTICARE. It's a brand form of lidocaine, and lidocaine is a numbing agent. It's a cream that you can put on the bottom, on the outside. Don't put this on the inside. Some people say that it burns when you first apply it, but that's something that usually goes away in about half an hour or so. So if you can tolerate that tingling, burning sensation, then that could be helpful for you. And you can put that on every 4 hours as you need it. There's another medication which could be helpful for softening your stools, because if you're taking pain medication, maybe you need some of this to help ease the pain so that you don't get constipated. Now, most women will probably stay away from narcotic medications which cause the constipation, but in case that you're not, then the stool softeners will definitely be helping you. But either way, you don't want stools that are harder, which may be more difficult to pass or be a little bit more abrasive on those hemorrhoids which are really suffering right now. Another one here is just laying down, okay? Laying down allows that blood to return back to your body, because if there's something on the outside of your anus, it's probably going to swell more if you're standing up or you're sitting up all the time. So when you're laying down, try to relax as much as possible. Allow that anal muscles to relax so that you can open up your bottom end, and then the fluid and the blood can start coming back in, okay? If you feel like putting a little pad there between your buttocks to put a little bit of pressure there helps you, that's a-okay to do too. It can help reduce some of the swelling and to help you feel better. Beyond that, and with the pain control with medications like Tylenol, the rest would have to be done with a surgeon like myself, okay? Because there are procedures that I can do to help you. especially if there's big blood clots that have formed underneath your hemorrhoids, and that's what's causing the swelling to occur. Usually these are very hard and stiff and very inflamed hemorrhoids, and they're very painful. But these can be, a procedure can be done in the office, and I do this all the time, to open up that blood clot, decompress it, let the pressure out, and also let the blood and any fluid, the inflammatory fluid, drain out as well. And that's really going to help to make these things smaller and also heal faster with time, compared to just doing it without any procedure, where you may suffer with that blood clot for 3 to 4 months at times. Okay, even if there isn't a blood clot, sometimes there can be a procedure I can do for you, because if there is causing a lot of pain for you, a lot of swelling, then usually there is something I can do to help you. And I think that when a baby first is born, there's so much to do, and mentally you're exhausted, physically you're exhausted. The last thing you need to do is deal with something like this, right? And you also, there's a lot of healing that the body needs to go through, so rest becomes extremely important, not just so that you can breastfeed the child, watch the child, but also to enjoy the child and enjoy and remember these precious moments, right? And I hope that this video can help you, give you a little guide as to what things you can do to help yourself. But when the pain is really severe and these over-the-counter things or usual home remedies don't help you, it's time to seek out a surgeon or specialist like myself. The gynecologist is also a good resource for immediate help, and they're probably immediately there for you in case you need anything. But in terms of hemorrhoid health, they won't be as updated or won't be able to provide the types of services that I can provide to you. So definitely seek out a specialist so that you can get the entire picture and the full breadth of services and methods to help you. Once again, if you are going through this right now, congratulations on your child and the new step forward in life. And I hope that you are dealing okay with this as best you can. And I hope you get the help that you need, and I wish you the best. Thank you so much for tuning in today. I really appreciate you joining me, and I hope to see you next time. Take care. Bye-bye.